health and ill health is a great equaliser. This is Chicken Shop Mile, Mile End Road. About 5 chicken shops in a row there. 42 per secondary school in Tower Hamlets. And I jest not when I say that I recommend McDonald's to my patients. That's the healthy end of the market. It's pretty bad and sad. If you take a 5-year-old in Tower Hamlets, 11% are obese. And by the way, don't get hung up on obesity, because malnutrition is the real issue. Obesity is the malnutrition you can see. The key to this is working out very quickly with a patient, actually, what is it they need and what is it they want. And that's the skill, I think, of a good doctor. It's what we try and teach our doctors.
I know as a practitioner, everybody feels that they want to treat patients, but actually what you're doing needs to be captured in a research framework. And if we're using different systems of diagnosis and treatment, how does the published research reflect the position on and provision of integrated healthcare? And how on earth can we manage to measure it? Because the whole thing is about research is measurement and changing patient outcomes and seeing if the patient's treatment is actually working.
We require MyCalls to be completed. Measure your self-concerns and well-being form. I'm sure some of you use those already. And it requires participants to nominate their concerns. So what is it that brings you here today? What do you want me to help you with? Can you tell me 2 things that are of concern to you? They rate those concerns and their general feeling of well-being, and then after the therapy, or usually if it's in a clinical setting, after a course of therapies, then they will be asked to re-rate those concerns again using the same scale. One of the questions that have come today about how can I persuade people that what I'm doing is effective, or how can I get into my GP's practice, this might be a really good way. It's really easy for you to do. You ask people some questions before your treatment and you ask the same questions after, and you'll be able to see, it's really affirming sometimes to be able to see the difference that you've made. But it's qualitative research. It is research that you can frame, take, and should be taken seriously.
And then there's some evidence coming that GPs that are having an interest in complementary medicine and do practice it are prescribing antibiotics 25% less. And you know, for the first time, the press has pricked up its ears. So it's the Department of Health. They're saying, well, actually, we thought there were a whole lot of freaks, but now suddenly, if they're actually reducing antibiotic prescribing by 25%, that's important, because people are already dying on intensive care units because we are running out of suitable antibiotics. Less intuitively, those that use the hospital services most can be greatly helped by a social prescription. And if you go to Rotherham, they've taken the 2 or 3% of the population that most use hospital services, and they've given them social prescription. And they found that those patients use hospital services and GP services 20% less at the end of that year. And they followed this group, the over 80s, for 5 years, and found that by the time it gets to 5 years, they're using hospital services 50% less.
So we wanted to further investigate, can to manage the white pelvic organ during pregnancy. We know from the literature that 25 to 30% of women are using can while they're pregnant. As I'm sure none of us in this room are surprised, many women don't tell their midwives and their doctors and obstetricians that, hey, I'm using reflexology or a massage. Healthcare professionals really need to know about this.
Really, on a simple level, and it may be simple, it may be really complicated, it's about enhancing relaxation. For us, bottom line, cancer and the journey can be a really challenging thing. If we can help people just get off that merry-go-round of fight and flight and stress, the knock-on effect can be enormous.
One of our places across the country reduced psychiatric acute admissions by a third by opening up a cafe 7 days a week staffed by mental health workers. Think out of the box.
The time is right for United Front to start being proud of what we have to offer, to explain why the health service and its patients can benefit so much from being able to access, yes paid, but being able to access complementary therapies, and start knocking back people who, for their own vested interests and their own vulnerabilities and insecurities, have fought very nastily over many years. But the only way we can do that is in strength of numbers.